Unionized workers in the Queen Elizabeth Hospital's engineering department vented their frustration outside of the country's primary medical facility. Among the issues they complained about were the need to replace the more than 30-year-old incinerator and rats being sighted in various departments.
There are several issues, but the incinerator is currently a first-generation incinerator. It is actually on its last legs. This incinerator has been in place for the last 32 years or so. And really and truly, the incinerator should have really been changed out at around 10 years or so.
The union fears that if the incinerator collapses, the QEH would be unable to burn medical waste, creating a health challenge. The union also raised the issues of procurement, restructuring, and rodents during that meeting.
Reports came to us that there are several departments currently at the back end of the hospital which currently have rodent issues. The carpenters and the painters workshop, and also areas like the kitchen. The kitchen is where meals are prepared for the patients here at the hospital. So that is why the workers felt strong enough that this was an issue that we needed to bring to light.
When I asked QEH communications specialist Shane Seeley if rats were running rampant as claimed by the workers and their representative, he had this to say.
Rodents are not running rampant at the QEH, Krystal. What I can tell you is that we have engaged the services of a private contractor. We've been seeing some rodents to the back of the hospital. Of course, the QEH is located right next to the wharf, and we know the situation around the Careenage area generally. What we've been able to do, the contractor, they've been able to put down 80 baiting stations, and we've engaged the Ministry of Health about that situation, and they're providing an additional 30 baiting stations so we can ensure that the rodents don't really come on to compound. But because of the nature of the location, we've had that problem to the back end. Of course, the back end is also where we have the garbage disposal as well. So that's where you would normally find the rat. So that is being dealt with by the contractors.
He added that replacing the incinerator is a priority issue for the hospital's board and management.
I can tell you that right now we are negotiating funds for the purchase of a new incinerator, and there's a possibility that that could be more than one incinerator as well. The funds are to be made available by the end of this year.
Mr. Seeley added that the safety and health of workers and patients remain a priority. Krystal Hoyte, CBC News.